Good afternoon, friends. I am back out in front of the office of one of my friends and favorite physicians, Dr. Jeremy Reed with Innovative Sports Medicine. It's been a while since I gave an update on what's going on with my knee and my leg. First, I have to say I have had fantastic outcome with the PRP, or platelet-rich plasma, in my hamstrings. I couldn't be happier with the results. So thrilled. And the last I'd come in here and talked about it, I was looking at treatment and getting a diagnosis for my right knee. So the last I'd shared, he had diagnosed me with a posterior lateral corner tear and some instability associated with that and a Baker's cyst. And so he had recommended some conservative treatment to see how that went with nitroglycerin patches, which I've been doing for several months. And I will say for the first couple of months, that worked really well. Then fast forward, and over the summer, with training more and kind of increasing my mileage in preparation for this race season, I've been having a little more pain. And so I am coming to see him today to kind of make a new treatment plan and see what he recommends. So he had initially said that if the nitroglycerin patches weren't effective anymore, that we might consider doing some stem cells for the little bit of arthritis I have in the inside or medial compartment of my knee, and then potentially some PRP for the posterior lateral corner tear. And so I'm coming to him today, not necessarily to get that treatment right now. I'm actually coming to him today to see what he recommends to kind of help me get through this race season first, and then consider doing those treatments after my 2 races. So just for context, I have 2 race goals, and I'll share them with you. One is my very favorite 5K of the year is coming up at the first weekend of October. It's the Fields of Dreams Uganda 5K. I'm going to put the link in here to share with you. If you live in the Springfield area, you can come and run it with me in Kabul. But honestly, no matter where you live, there's a virtual option to register for the race and participate. And here's the beauty. Even if you're not a runner, even if you don't want to walk it, you can still register because the registration fee goes to a wonderful cause and helps benefit the amazing children in Uganda. And when you register, you have the option to sponsor a Ugandan runner. There's going to be over 2,000 runners in Uganda on the same day as our race, at the same time as our race is held here in America. So please register for the race. It's so awesome. And then my second goal is the first weekend of December is the St. Jude Marathon in Memphis at the main St. Jude campus. And I've had several friends, and I won't mention you, but you all know who you are, who've been beneficiaries of St. Jude and the amazing organization and the amazing gift that they do with helping children battling childhood cancer. And so I have been supporting them. I love their organization, love my friends who have come through that and survived because of the treatment there at St. Jude. And so I'm very excited to run that race, and you can help me be a fundraiser. So I've already done some of my financial commitment, but there's a lovely opportunity for those who want to support the fundraising campaign to support me as a runner. And so I'm going to put that link in here too. I would love for you to consider being a supporter. So I will come back in here in a minute and tell you what I find out about my knee. Okay, I'm out. Great appointment. I love Dr. Reed and Faye and David. The whole staff is wonderful. Cannot recommend highly enough. I would even recommend you come from out of town all the way to Springfield to see them. They're that good. They drained the fluid out of the Baker's cysts. There were a few different ones. I think he said 5, maybe more. And so he went into each individual cyst and drained as much thick fluid that he could off of that. And then did some cortisone injections around my knee to kind of help with the inflammation and calm it down to kind of get me through this race cycle. And then I went ahead and made an appointment the second week of December after the St. Jude Marathon for some stem cell injections. And so they're going to address a few things. I'll start a new video for that one. I have a little bit of degenerative change in the medial compartment or inside compartment of my right knee, and then also a little bit of fraying on my medial collateral ligament that they're going to do injections. And then in my posterior lateral corner, they're also going to do some injections on that where I have some tearing and a little bit of instability. And I'm going to take care of that right away. And so One thing I would say that I love about doing this is that I don't have terrible pain. I'm uncomfortable and I do have some pain, but I don't want to wait until it's so bad that I need surgery or need more treatment. I'm trying to nip it before it gets really bad. And that's what I love about regenerative medicine, is that it can treat a lot of things before they get so bad that you have to have surgery. So I'm a huge fan of that. Would recommend that if you're having any pain. Yeah, so there you go. If you're interested, I was going to post a couple of pictures. So I took a picture of the ultrasound of the back of my knee so that you can see the several cyst pockets. If you don't like that sort of stuff, it's just an ultrasound image. Don't look. And then the next picture I'll post after that is the fluid that he drew out of those cysts. Again, it's just it's a vial, and it shows the fluid that was in the back of my knee if you're curious. If you don't like that sort of stuff, then scroll on and don't look. So there you have it.